Nairobi, Kenya. Today is a new day that we thank God we have it. So I'll be talking about ectopic pregnancy. I'll give you more insight about it. What are the causes? How can you know that you have ectopic pregnancy? What is the difference between ectopic pregnancy and the normal pregnancy? So join me live from wherever you are. Tell me where you're coming from. In case you have a concern, kindly address it in the comment section. I'll be able to respond. So if you're joining me live, give me a thumbs up and let's be active in the comment section. So say hi. If you've joined me live, kindly say hi. Tell me where you're watching me from. So first, you need to understand what it means by ectopic pregnancy. So ectopic pregnancy is when fertilization takes place, but implantation takes place outside the uterus. Usually, an ovum is released from an ovary, get fertilized in the fallopian tube, and implants itself on the walls or on the lining of the uterus. That is a normal pregnancy, how pregnancy normally occurs. But in ectopic pregnancy, instead of implantation taking place in the walls of the uterus, it takes place outside the uterus. That is what is called ectopic pregnancy. A number of individuals, around 2% of pregnancies are always ectopic pregnancy. But usually you don't know that you have ectopic pregnancy from the beginning. It's not easy to differentiate whether you have normal pregnancy or ectopic pregnancy, because the signs and symptoms from the beginning are always similar. But when remember ectopic pregnancy, there is no chance of survival for the fetus because of the limited area of growth. So ectopic pregnancy occurs in different places. One of them is in the fallopian tube. So the fertilized egg can attach itself on the walls of the fallopian tube. In fact, 90% of the cases happens in the fallopian tube. It can also occur in the ovaries, also in the lower section of the uterus, that is in the cervix, and also in the abdomen. So those are areas where implantation can take place outside the uterus. So when implantation takes place in those areas, we call it ectopic pregnancy. So in the fallopian tube, in the I talked about implantation can also take place in the abdomen or the abdominal region. So we have two types of ectopic pregnancy in the abdominal region. So in the abdominal region, it can be either primary ectopic pregnancy or secondary ectopic pregnancy. So primary, it means implantation directly occurs in the abdomen, or for example, or that is primary ectopic pregnancy, while secondary ectopic pregnancy in the abdomen occurs when the fertilized egg exits from the fallopian tube to the abdominal region. Now it's become a secondary part of or point of attachment. So I've said that ectopic pregnancy cannot proceed as normally. So the growing tissue can always become life-threatening and cause bleeding, in fact life-threatening bleeding, which can lead to shock and even death. So if you have a ectopic pregnancy, you are always at risk of losing a lot of blood, and you can end up losing your life. So it is always very prudent to know this thing very early. You know the signs, so that if any case you see any of them, you visit a health facility very fast, so that you can get medical attention. So stay tuned with me so that we learn together. What causes ectopic pregnancy? There are various causes of ectopic pregnancy. One of them is inflammation of the fallopian tube. So it can be inflammation or scarring in the fallopian tube. So remember, in the fallopian tube we have cilia. There is always ciliary, the movement of fertilized ovum to the uterus is facilitated by cilia. We call it ciliary motion. So when there is a problem or scarring in that fallopian tube, that impedes or prevents movement of fertilized egg from that point to the uterus, that one can cause ectopic pregnancy. So inflammation in the fallopian tube can cause ectopic pregnancy. We also have hormonal imbalance, genetic abnormalities. There are people born with people who have genetic abnormalities, and also we have other medical conditions that can cause fallopian tube to be misshapen. So we have also other medical conditions that we will discuss in a short while. So after knowing the causes of ectopic pregnancy, we need to understand there are also several risk factors that can put you or make you develop ectopic pregnancy. But before that, let us learn about types of ectopic pregnancy. There are three types of ectopic pregnancy. Three types. The first one is tubal pregnancy. So in this tubal pregnancy, the implantation takes place in the fallopian tube. In tubal pregnancy, implantation takes place in the fallopian tube. So I'm talking about the types of ectopic pregnancy. I've started with the tubal pregnancy. So the fallopian tube has three different parts as parts. In fact, there are four. We have the ampulla, where usually the fertilization takes place. Fertilization takes place in the ampulla. We also have the isthmus, the infundibulum, and also the interstitial part of the fallopian tube. So in tubal ectopic pregnancy, implantation of the ampulla is the most common. It's about 55% of the tubal ectopic pregnancy, and it's very narrow. The ampulla is narrow, so it normally leads to rupture of the fallopian tube. So the pregnancy at the isthmus point, at the ampulla point, does not proceed beyond 8 to 12 weeks. So there's no usually abortion that happens between 8 to 12 weeks if implantation takes place at the ampulla region. Then we have the isthmic point. So 25% of tubal ectopic pregnancy occurs at that point. So this is the narrowest point of the fallopian tube. So it normally ruptures at 8 weeks, between 6 to 8 weeks. Then the next part, we have the infundibulum, which contributes to 18% of tubal ectopic pregnancy. And lastly, we have the interstitial part, which contributes to 20% of tubal ectopic pregnancy. This is the longest part of the fallopian tube. Normally, ectopic pregnancy has the longest survival in this part, around 12 to 16 weeks. So 12 to 16 weeks, that is in months, that is 3 to 4 months. So that is the longest tubal ectopic pregnancy in can last. So if you are joining me live, kindly like my live stream, interact with me in the comment section, tell me where you are coming from, let me appreciate you and recognize you. So that is tubal ectopic pregnancy. I said there are 3 different types of ectopic pregnancy. So that was tubal ectopic pregnancy, which is tubal ectopic pregnancy contributes to 90% of ectopic pregnancy. I said that there are different areas where ectopic pregnancy can take place. That is tubal, in the fallopian tube, in the cervix, abdomen, and can also take place in the ovary. But tubal is the most frequent one. That's why I've discussed it extensively. So I'm requesting you to kindly pardon me about the different types of ectopic pregnancy. There are 3 different types of ectopic pregnancy. Tubal is just one of the areas where ectopic pregnancy takes place. But the 3 different types include acute. You can have acute stroke ruptured ectopic pregnancy. Second one, we have unruptured ectopic pregnancy. And thirdly, you can have chronic ectopic pregnancy. So those are the 3 different types of ectopic pregnancy. The ones I was talking about, the tubal, the abdominal, those are areas where they can take place. But now in terms of types, we have 3 different types: the acute or ruptured. Secondly, we have the unruptured and the chronic ectopic pregnancy. So I'll tackle them one by one so that you understand them better. So if you have acute or ruptured ectopic pregnancy, that is, we call it obstetric emergency. This is adrenaline rush phenomenon. So in this case, the tube has ruptured. Remember, the ectopic pregnancy cannot survive beyond certain weeks. So because the tube is very narrow and cannot grow compared to the uterus, so it will burst. The growth of the fetus will make the tube burst. So when it bursts, the contents will spill into the abdominal region, into the peritoneal cavity. So this one will lead to bleeding, which can cause shock, and also you can become unconscious. So in acute, when it starts, it has acute onset, acute ectopic pregnancy. And then we have the unruptured. The unruptured, the ectopic pregnancy does not rupture, not causing intraperitoneal bleeding. So in the acute one, it ruptures. Then the second type is the unruptured one. Then the third type is the chronic. So in chronic ectopic pregnancy, the ectopic pregnancy has ruptured, but the bleeding has stopped because the drain has been sealed. So in the chronic, this patient had bleeding in the first place, and then the body mechanisms seal the drainage. So you'll find some spillage into the abdominal cavity, but the bleeding has stopped. So that is the chronic. So these patients, they are critically ill, but at that point, it is not obstetric emergency. It's not an emergency. So kindly, if you have a question, ask me, contact me in the comment section, and let us interact, guys. I appreciate so much for your support, for you taking your time to join me live. And don't leave. If this is your first time of joining my live, kindly support me by subscribing to my channel. Thank you, guys. I'm seeing our number is growing. Today I'm targeting to reach at least 10 people in the live stream. So kindly join, share me out to your friends, like my live stream, and let's grow together, learn about our health. So ectopic pregnancy, when you have ectopic pregnancy, the signs and symptoms, the initial signs and symptoms are the same with the normal pregnancy. Like you have amenorrhea. Amenorrhea is simply you've missed your period for around 6 to 8 weeks. The nausea and vomiting, the normal signs, but as you progress, these symptoms become worse, and then you start having severe abdominal pain, vaginal bleeding, such kind of symptoms. So when you are pregnant, or when you suspect to be pregnant, bleeding is a danger sign. I talked about in my previous videos, danger signs in pregnancy. Bleeding is always a danger sign in pregnancy. So whenever you see bleeding or spotting in pregnancy, kindly contact your physician for further assistance. So when you are a medical practitioner, you are a nurse, and a patient comes into the facility, you should always have conscious awareness about ectopic pregnancy. Remember, when I was talking about the different types of ectopic pregnancy, the first one was acute ectopic pregnancy. So how can you diagnose someone with acute ectopic pregnancy? First, it normally occurs in the young adults between the age of 20 to 30 years, and mostly in nulliparous, those who have not given birth, those who are pregnant for the first time. And if you have undergone infertility treatment in the recent past, and also it has early or acute onset. So suddenly you have acute onset of abdominal pain, vaginal bleeding, such kind of symptoms. Then you should suspect that the patient might be having ectopic pregnancy, and therefore you should proceed and do further investigation. So these patients, they normally come to the clinic with the history of amenorrhea. They come with the history of amenorrhea. So short period of 6 to 8 weeks or of delayed period, or they can have slight spotting, or yeah, those symptoms. Secondly, they will come with abdominal pain. So this is the most common symptom of ectopic pregnancy, abdominal pain. So the pain is always agonizing because of the distension of the tube and also the irritation of the peritoneal region. They will also present with the vaginal bleeding per vagina. So, and it's always sometimes can be slight, sanguineous, or can be dark colored. And then they will also tell you that they are nausea, vomiting, fainting attacks. Yeah, which is very common because maybe you have started to lose blood internally. Remember, when you can bleed internally in the abdominal region, or just per vaginal bleeding. If it is too heavy, these people will lose a lot of blood and can be experience signs of shock such as fainting. They will also be pale. When you check into their sclera, they will be pale. They can when you take their blood pressure, they have low blood pressure, hypotensive, tachycardia, and you have tenderness in the abdomen. So in the unruptured ectopic pregnancy, I've said in unruptured, you have ectopic pregnancy but has not ruptured. So they will also have similar, they have delayed periods, they have uneasiness in one side of the flanks, and also colic pain in nature. And then the uterus is slightly smaller than the period of amenorrhea. Remember, someone telling you that is 4 months pregnant, but the uterus is small. This simply because the fetus is growing outside the uterus. And then the chronic ectopic pregnancy, there will also be cases of amenorrhea of 6 to 8 weeks of delayed period, low abdominal pain, and vaginal bleeding. Now, what are the risk factors of ectopic pregnancy? What can put you into risk of getting an ectopic pregnancy? One of them is previous history of ectopic pregnancy. So if you had ectopic pregnancy in the past, then there is a chance of around 10 to 15% chance of repeat of ectopic pregnancy. So number one risk is previous history of ectopic pregnancy. I've said that there is 10 to 15% chance of repeat of ectopic pregnancy if you have had before. Sexually transmitted infections like gonorrhea. This infection, they can cause inflammation of the fallopian tubes. Remember, inflammation will narrow the fallopian tube and can cause delay of transportation of the fertilized egg into the uterus, and therefore implantation can take place. So these STIs, we can also have chlamydia infections. Yeah, So this infection can ascend into the fallopian tube and cause inflammation. If you have have multiple abortions, like the previous induced abortions, remember these abortions, one of the things they put you into is they put into risk of having some infections. One of them I've just mentioned is chlamydia infections. So chlamydia infections, they can ascend into the fallopian tube and cause inflammation. Smoking just before getting pregnant, smoking puts you into a risk of also having ectopic pregnancy. So if you are planning to be pregnant, you should stop smoking. So studies have shown that smoking increases the risk of ectopic pregnancy. Maternal age of 35 years and above. So older mothers of 35 years and above have also a greater risk of having ectopic pregnancy compared to younger mothers. Pelvic inflammatory disease. One of them is salpingitis. Salpingitis is inflammation of the fallopian tube. So these diseases, they make it very difficult for fertilized egg to be transported into the uterus, and therefore these eggs, they can end up implanting themselves on the walls of the fallopian tube and cause ectopic pregnancy. So just let me explain this point of pelvic inflammatory disease. That is, one of them is the salpingitis. So if you have sexually transmitted diseases like gonorrhea, chlamydia infections, post-abortion, and even puerperal sepsis, they can cause ectopic pregnancy because there will be loss of cilia and impairment of the muscular peristalsis. Therefore, the transportation of the fertilized egg from the fallopian tube to the uterus will be impaired. There will also be narrowing of the lumen of the fallopian tube. Can also cause kinking. Kinking is just a twist. Kinking and angulation of the fallopian tube. And lastly, there can be pocket formation due to adhesions between muscular mucosal folds. So that is why PID, or pelvic inflammatory disease, is a major risk factor of ectopic pregnancy. So use of assisted reproductive technology like the vitro fertilization. Research suggests that women who have undergone vitro fertilization are more likely to have ectopic pregnancy. So some of these artificial methods can also put you into greater risk of having ectopic pregnancy. That is according to research. History of infertility also increases the risk of ectopic pregnancy. If you have conditions like fibroids, endometriosis, there is also a greater risk of having ectopic pregnancy. Birth control methods. We have other methods like the intrauterine device. So when you have intrauterine device, these devices, they prevent you from getting pregnant. But if pregnancy occurs, it will most likely be in the fallopian tube. Remember that intrauterine device is in the uterus, so it prevents the implantation of the fertilized egg onto the walls of the uterus. So if you get pregnant with this device inside, then probably most likely the implantation will take place in the fallopian tube. And then another birth control method is tubal ligation. Tubal ligation where you ligate the tube. The tube is cut. So that is a permanent method of family planning. One of the permanent method of family planning. It also increases the risk because still, in rare occasions, the ovum can still be produced. And remember, it will not cross over to the uterus. So there is a probability that it will implant on the fallopian tube. So those are some of the great risk factors you should always watch. If the reducible, we call them, we have modifiable risk factors and non-modifiable risk factors. Modifiable risk factors these are factors that we can change. For example, you can stop smoking. Yeah, you can also, the infections you can treat, things you can avoid to reduce the chances of having ectopic pregnancy. So what are the signs and symptoms of having ectopic pregnancy in general? Signs and symptoms of having ectopic pregnancy. First, one of them is you'll have, the first one I said, which is very common, is abdominal pain or discomfort. So you'll have abdominal pain. This one can come mostly after having sex. So if you have sex and you are pregnant, and after that you experience abdominal pain, you can start suspecting ectopic pregnancy. Yes, abdominal pain can be there at any time, but if you experience abdominal pain mostly after having intercourse, then you can suspect ectopic pregnancy. Another one is vaginal bleeding. It can vary in amount. Remember, if you are pregnant and you see blood, it can signify different things. One of them is you can be having miscarriage. But remember, when you have miscarriage, you have heavy bleeding, and this, which contains clots, huge clots, because of the products of conception being removed or coming out. But in ectopic pregnancy, the type of bleed can be light, can also be spotting if you have ectopic pregnancy. So there is difference between bleeding in ectopic pregnancy and if you have miscarriage. So this one you have very light, can be spotting, and can be dark red. While bleeding in miscarriage, it is heavy with clots. So you will have sudden low abdominal pain. The low abdominal pain I've explained very well. You can also have pelvic pain and discomfort. Sometimes even movement will become a problem, because if you have pelvic pain or discomfort, movement can be compromised. And then you can also experience dizziness and fatigue. Remember, when you lose blood excessively per vaginal bleeding, or when the ectopic pregnancy bursts and you bleed into the peritoneal or abdominal region, you will experience signs of shock like fatigue, dizziness, among others. So for those who are joining my live stream, today I'm talking about I'm talking about symptoms, signs and symptoms of having ectopic pregnancy. How can you differentiate ectopic pregnancy and normal pregnancy? From the beginning, it is not easy to tell whether you are having normal pregnancy or ectopic pregnancy until you start experiencing these severe symptoms of ectopic pregnancy. So in the beginning, when you test the pregnancy, it will be positive, just like the normal pregnancy. There will be presence of this HCG hormone in your urine, which will indicate that you are pregnant. But after a period of 6 to 8 weeks, you will have symptoms, severe symptoms, which I've clearly discussed. One of them, you'll experience vaginal bleeding, which is light, can be spotting, dark red. You also have pelvic pain, stroke discomfort, low abdominal pain, which is acute, breast discomfort. You can also experience signs of shock like dizziness, fatigue, and even fainting. So if you are a clinician or you are a medical practitioner and your client comes with such complaints, always have in your mind about ectopic pregnancy, because you can save life. And if you are not conscious enough, you can easily lose this mother. It is always good to be aware of such situations. Be conscious of such situations. So I was talking about the signs and symptoms of ectopic pregnancy. What are the risk factors of ectopic pregnancy? Different types of ectopic pregnancy. Then how can we prevent? Lastly, how do we prevent ectopic pregnancy? You should be able to know that it's not easy to prevent ectopic pregnancy, but there are ways we can do. There are things we can do to reduce the risk of having ectopic pregnancies. One of them is use of condoms during sexual intercourse. Remember, I talked about the sexually transmitted infections like gonorrhea. So these infections, they can cause inflammation of the fallopian tube. So when you use condoms, you prevent, you lower the chances of getting these STIs. And also, you can reduce the number of having multiple sexual partners. Also, to do the same of reducing the chances of having STIs. The third way of preventing or reducing the risk of having ectopic pregnancy is to treat infections. Remember, these infections, they can ascend to the fallopian tube and cause inflammation or scarring. So when you treat the infections very early, you also reduce the chances of having ectopic pregnancy. And lastly, abortions. These induced abortions, the unnecessary abortions, only do abortion if it is recommended by medical practitioner. Multiple abortions can increase the risk because there will be scarring. There can be scarring in the fallopian tube. So when there's a scarring in the fallopian tube, then the movement of the ovum to the uterus can be compromised. So once that movement is compromised, then it will surely implant itself on the walls of the fallopian tube. So let's avoid unnecessary abortions, which will increase the risk of having ectopic pregnancy. So there is no definite way to prevent this, but there are only ways to reduce or minimize the chances of having ectopic pregnancy. We should always be on high alert on the symptoms of ectopic pregnancy. For those who are joining me live, kindly give me a thumbs up. If you have any question, ask in the comment section. Let us interact. I'll answer you there right away. I want to appreciate everyone who has joined me live. continue giving me support, guys. Yeah, don't leave without subscribing to my channel. This is called Amazon Health Talks. We are dedicated to educating you at the comfort of your home. We give you health talks on different topics to increase the awareness and improve on your health. Thank you guys for joining me live. Feel appreciated. So what is the difference between the normal pregnancy and ectopic pregnancy? Remember, normal pregnancy, the pregnancy will reach term, which is after will last for 9 months. But ectopic pregnancy can barely goes beyond 3 months because of the limited growth in the fallopian tube, which will eventually burst or rupture. So that is the big difference between the normal pregnancy. The normal pregnancy will reach term and will have less symptoms, while ectopic pregnancy has life-threatening symptoms. These life-threatening symptoms I've discussed down below. One of them I've said is bleeding, which is life-threatening. Remember, when you lose a lot of blood and you are pregnant, you can easily lose your life. Again, severe abdominal pain. So when you have ectopic pregnancy, it is unfortunate that there is no way it can survive. So it has to be terminated, either through surgery or through other ways. But ectopic pregnancy cannot survive to 9 months, to term. So when you have ectopic pregnancy, you can end up losing both lives. you can end up losing both lives, the life of the mother, and obvious the fetus. That of the fetus has to be terminated. So that pregnancy must be terminated. But if you are not careful or prevent it early enough, detect it early enough, you can end up even losing the life of the mother. Remember, this is one of the causes of maternal mortality death. So we must be on high alert to reduce maternal mortality. No one should lose life because of such preventable conditions. I always say that you should not lose life because you are pregnant. Pregnancy is not a disease, but it is just a condition which is manageable. Kindly interact with me in the comment section if you have any question. So you should know the signs and symptoms of normal pregnancy. Signs and symptoms of normal pregnancy. Let me tell you some signs. One of them is morning sickness. This one is not common to everybody, but is one of the most common symptoms, morning sickness, where you feel nausea and vomiting. There is also tiredness. Constipation is also a sign. Pain in the pelvic girdle. You can feel some discomfort in the pelvic girdle. Breast tenderness. So breast tenderness normally happens because of high levels of some hormones in the body. So you'll feel tenderness of the breast. Heartburn, nausea, among other many symptoms. And remember, if you're pregnant, the only time you can see spotting, some slight spotting, is within 2 weeks of conception. What is normally termed as implantation bleeding. So after conception, within 2 weeks, during implantation, you can have some spotting. That is within 2 weeks of conception. Any bleeding after 2 weeks in pregnancy is a danger sign. And one of the things it can show is having ectopic pregnancy. So when you have ectopic pregnancy, it will raise alarm. When you reach 2 months, that is 8 weeks, these symptoms will be severe. That is of abdominal pain, increased vaginal bleeding. They will become severe after 8 weeks. It is difficult to know that you have ectopic pregnancy before 2 months of gestation, before 8 weeks of gestation. So when you suspect the pregnancy is not normal or the symptoms you are experiencing are not normal, you can always rush to the facility to be helped. There are so many investigations. One of them is abdominal ultrasound, which can be done and visualize where the implantation has taken place. So that one will help physicians to make correct diagnosis if you have ectopic pregnancy or not. So apart from the above signs that I've mentioned about normal pregnancy, remember we have different signs. We have probable signs of normal pregnancy, we have positive signs and probable signs, positive signs, and possible signs. So one of the possible signs is the first thing you will notice is missed periods. That is the first thing, whether it is ectopic pregnancy or normal pregnancy. Missed period is the first thing to suspect. If you have your missed period between 6 to 8 weeks and you have those other symptoms, then you can suspect that you might be pregnant. So whether it is normal or ectopic is subject to other further investigations. Remember, some individuals have nausea without vomiting. Some will experience vomiting, others will not. And also increased urination to other people. When you are pregnant, the amount of blood in your body increases, causing your kidneys to process extra fluid that ends up in your bladder. So that's why for individuals who are pregnant, they have increased urination. And also as the pregnancy grows, remember it's exerting the pressure on the bladder. So every time there's accumulation of urine in the bladder, you feel like urinating. There can also be change in your mood swings. So pregnant women normally have mood swings. This is because of flood in hormones in your body during early pregnancy. There can be light spotting. I would say light spotting within 10 to 14 days after conception, which is known as implantation bleeding. Bloating can also happen because of the hormonal changes in early pregnancy. Cramping. So cramping, the cramping is that slight abdominal pain. You normally feel cramping. So this cramping, remember during implantation, you can feel some pain, but that is normal. If it is severe, then you can suspect other conditions. Other signs of pregnancy is we have cravings for some types of foods. So you can either be cravings for some types of foods, or you become more sensitive to some odors, and even sense of taste might change. So there are some odors that will make you feel nausea and even make you to vomit. It's okay. Thank you. So kindly, if you are joining me live, say hello, ask me any question. I'm here to help you understand more about ectopic pregnancy or anything pertaining pregnancy. Don't struggle if you have any problem with pregnancy. My work is to educate and empower you with knowledge. So for those who don't know me, my name is Nurse Dennis. I'm a nursing officer by profession, and we swear to help people live to see another day. So nursing is a very important and noble cause because God has given us that grace to help people. One of the strangest symptom of pregnancy, I've mentioned constipation. These hormonal changes in your body. Remember, during early pregnancy, there are a lot of hormonal changes in your body, and they can cause your digestive system to slow down, which can lead to constipation. So it is this influx of hormones in your body, and then can interfere with your digestive system, which in turn will slow down and cause constipation. So if you are pregnant, when should you be worried? If you are pregnant, when should you be worried? You should be worried when you start having vaginal bleeding, when you start seeing blood coming. Secondly, you start experiencing abdominal pains, severe abdominal pains, pelvic discomfort, nausea and vomiting. So nausea and vomiting is a normal sign but when it is too much, nausea and vomiting, you should be worried. And this abdominal pain, it's normally acute or sudden. It has sudden onset. So if you have sudden onset of abdominal pain, you see vaginal bleeding, you have other discomforts like nausea and vomiting, then you should be worried if you are pregnant and make prompt decision and actions to save both your life and the baby if possible. Remember, when you have two scenarios where you need to save the life of the baby or the mother, the life of the mother should be saved first. If pregnancy puts your life into danger or risk, then the laws of our land allows medical officers to make that agreement or allow them to terminate the pregnancy. So the pregnancy can be terminated to save the life of the mother. So if the pregnancy is putting the life of the mother in danger, then we are allowed to terminate that pregnancy, which is legally allowed in our constitution. So always be watchful of any danger signs during pregnancy. Kindly, if you've not watched my video of danger signs during pregnancy, just check in and watch them and learn. Be aware of any danger signs. These signs and symptoms are included in those danger signs during pregnancy. So go to my videos, watch them, and help us educate and empower our people with more information. So tell me where you are watching me from. Let me recognize you and say thank you. If you've joined me for the first time, kindly subscribe to my channel. Let us connect. Let me know my audience. I've said my name is Nastenis. I want to know my audience and most importantly, give you information which is required in your daily to daily lives. If you have any concern, ask. What else do you want to know about ectopic pregnancy? Tell me, what else do you want to know about ectopic pregnancy? I've said 2% of pregnant women or pregnancies are ectopic, end up being ectopic. And the sad thing is that there is no way you can transplant ectopic pregnancy into the uterus. It has to be terminated. It has to be terminated. Kindly interact with me in the comment section. Tell me where you are supporting me from. So you should know the early warning signs of ectopic pregnancy. One of them is light vaginal bleeding and pelvic pain. Those are the early warning signs. And remember, if blood leaks from the fallopian tube, you can end up having some symptoms like shoulder pain and urge to have bowel movement. So at that point, you'll have shoulder pain and urge to have bowel movement. When you go to the toilet, nothing will be coming out. Then we have emergency symptoms. If the fertilized egg continues to grow in the fallopian tube, it can cause the tube to rupture. That one I've stated very clearly. So heavy bleeding inside the abdomen is likely. Symptoms of life-threatening events include extreme lightheadedness, fainting, and shock can be experienced. So when there is bleeding into the abdomen, you will feel lightheadedness, you will feel like fainting, and also shock. So at this point, when you feel like you have severe abdominal pain, extreme lightheadedness or fainting, and even shoulder pain, kindly rush to the hospital to see a doctor. So I want to say thank you for those who joined me live. May God bless you for sparing your time to be with me today. I don't take it for granted. And before you leave, kindly give me a thumbs up, subscribe to my channel, and I'm very happy for your support, guys. May God bless you. May you have a fantastic evening. Until tomorrow, God willing, we will have another message to share with you. My name is Nas Dennis. Before you sign off, receive my gratitude. Thank you.